So this is not an easy question to answer. Even experienced cardiologists can sometimes find it difficult to decide whether it's a heart attack or not, and sometimes need ECG and many investigations to really make a final diagnosis. But there are several points which can be of help to a layperson to decide whether this is something which needs attention or not. So I'd like to say what are the characteristics which make you suspicious that it could be a heart problem, and what are the points which point against it. So the heart is an internal organ, and the body handles pain in internal organs a little differently from the surface of the heart. For example, if a mosquito stings you, you know exactly where the pain is and where you can localize the pain. But for internal organs, the brain refers the pain to the surface of the body, and it's not very accurate. It's generally over a larger area and could be very variable. So as far as cardiac pain is concerned, it can be anywhere from the lower jaw up to the umbilicus. So it's a large area. Typically, it's in the center of the chest or to the left side, left arm. That's what most people know. But it can also be on the right side, right shoulder, right arm, back, as I said, neck, and up to the umbilicus. Then the character of the pain, most people expect a very severe pain, which it could be. But sometimes it's just a burning sensation. So understandably, if you have a burning sensation in the upper part of the stomach, everyone will assume it is gastritis or gastric problem. In truth, there are so many other conditions which can also mimic cardiacs, not just gastritis. So it can be a burning sensation, it can be a heaviness. Very often it's just a weight on the chest or a constricting feeling in the chest, which may or may not radiate down one arm or the other. The duration is also important. Any pain that lasts less than 30 seconds is not cardiac. Any pain that lasts more than 6 hours is unlikely to be a heart attack, but very often, because it's not the full-blown attack, it can be a stuttering attack, it can last much longer than that, 12 hours, sometimes longer. But if it's been happening repeatedly, let the patient says that I've had this pain, this kind of pain, lasting 6-7 hours, I've had it last week and last year and like 2-3 times a month, obviously each of those couldn't be a heart attack, right? So if it's been multiple similar episodes in the past, one would kind of ignore that. Now, there are a few points which point away from being a heart attack. Like I said, since the heart is an internal organ, you cannot make the pain worse by, say, pressing on the area. So if there is pain, now if a patient comes to me and says, Doc, I got pain here, and points with 1 or 2 fingers, straight away in my mind I'm thinking that this patient doesn't have a heart problem. Because as I said, it's a referred pain, it's generally over a large area. They come with a hand on the chest, or it's a more diffuse area. If you press the area of pain and it gets worse, it's likely to be local. If it gets worse with movement of the arm or the neck or the shoulder, again, it's more likely to be musculoskeletal. So these are some points which can help you decide whether you need to take it seriously or not. In short, any kind of discomfort which needn't be pain, heaviness, burning, from the jaw to this, associated with sweating, which is a very important associated symptom, should be taken seriously. Similarly, if it's associated with breathlessness or lightheadedness, these are symptoms which should prompt medical attention. And if it is a heart attack, then 50% of the deaths due to a heart attack occur in the first 1 hour. So that's the golden hour, we say. So it's important to get to a hospital with good medical facilities as quickly as possible if you think it's going to be a heart attack. A lot of the delay is because the patient thinks it is something else, then doesn't want to wake up his wife, doesn't want to bother the neighbor, but then after an hour or two, he eventually does it. So if you think it is likely to be a heart attack, then get to a hospital quickly. The background of the individual also plays a huge role. Now, if a young lady, you say a 20, 30-year-old lady, who doesn't have major risk factors, has fairly typical symptoms, it's very unlikely to be a heart attack. Because the chance of a young woman who doesn't have risk factors, non-diabetic, having a heart attack actually is quite low. Because age is the strongest risk factor, and conversely, young age is the greatest protector also. We don't see this in male smokers. Lot of our young male heart attack patients are smokers. They come in their 20s and 30s with heart attack. So if you have multiple risk factors, even somewhat atypical symptoms probably warrant attention. And if you're young and without risk factors, probably we also don't go aggressively after such patients if we think that they don't have much risk factors. Of course, we are only talking of statistical probability of a heart attack, and only tests will tell us further. The key is probably keeping all the risk factors under control, as was mentioned by the earlier speaker, and regular checks. So if you're a diabetic, and you should probably go for a regular checkup, and your cardiologist will assess that and tell you what the probabilities of a heart problem is, and if that is the case, how to take preventive measures.
Okay, good. Thank you very much, Dr. Varghese. Thanks for your inputs. We got a fairly clear idea now how to differentiate. I think definitely the audience will take note of that. So we'll come back to you in the panel to have more insights on this. Thank you.
Thank you.
Dr. Yeah.